Thanks everyone for joining us and welcome Dr. Slaughter-Acey to speak with us today about some really exciting work on, as you can see, racial segregation, colorism, and discrimination among expecting Black mothers. Just for a little bit of background on Dr. Slaughter-Acey, she is an assistant professor of epidemiology at the University of Minnesota in the School of Public Health. She received her doctoral training in maternal and child health epidemiology from UIC in Chicago, and then went on to some postdoctoral training at MSU, Michigan State University. Broadly, her teaching, research, and service focuses on the socio-environmental and psychosocial determinants of women's and family health, with an emphasis on health equity. A focal area of Dr. Slaughter-Acey's research is the study of structural, cultural, and intergenerational racism and how systemic racism impacts women's health peri-pregnancy. Dr. Slaughter-Acey is also the PI of IRISE, the IRISE Collaboratory, and IRISE stands for the Interdisciplinary Research Invested in Social Equity. This aims to integrate social science literature with epidemiologic and systems science literature to study systemic racism, structural and cultural, and the role of racial ethnic identity and race consciousness in the patterning of health. She has received funding from the Russell Sage Foundation and the NIH for her research investigating the social significance of skin color as a driver of health and healthcare for Black women. In 2020, Dr. Slaughter-Acey's research on skin tone bias and racial discrimination in prenatal care was honored, congratulations, with the NIH's Matilda White Riley Award for Promising New Investigators. Most recently, she was awarded an R01 from the National Institutes of Aging to investigate the impact of maternal social environment across the life course for Black women on the maternal epigenetic profile and their perinatal outcomes. So long introduction, it's a great pleasure to have you here, Dr. Slaughter-Acey, and we're looking forward to hearing your talk. Thanks for joining us. You need to unmute. I need to mute.
All right. Thanks for having me. I'm really excited to be here. Despite our little Zoom technicalities, just getting squared away. Okay. So, you know, Black women, Black birthing individuals are 3 to 4 times more likely than white birthing individuals to experience pregnancy-related mortality, depending upon intersection with education, income, etc. And this disparity has everything to do with the lived experiences of being a Black woman in America. And the disparities that I just mentioned, they're not just current, they have existed over time, and they really haven't made much movement. And if we look at infant mortality, and I'm using infant mortality here because, and not maternal mortality here, in part because the surveillance, the way that we do surveillance for maternal mortality changed in 2007. So there's an interruption, or it's difficult to compare data pre-2007 to post 2007, but the pre-2007 data pretty much maps onto this infant mortality graph or plot by race ethnicity. And you can see that from 1915 to 2017, that yes, there's decrease in infant mortality for both Blacks and whites, but the Black-white ratio, so that disparity in infant mortality rates has been increasing significantly since the 1950s, with a marked decrease only occurring shortly after the passage of several civil rights acts, as well as Voting Rights Act. And what I really want to say here is that it's not race that is the risk factor that is leading to these perinatal disparities, that it's really racism. And my program of research really looks at how social exclusion and marginalization impacts Black women's health through the allocation of health promoting resources, exposure to chronic and race-related stress, as well as those individual and collective resilience resources. And so in trying to show that it is racism and not race as the risk factor, although I'm happy to say that as I have done this across my career thus far, we are starting to move, not have to have the conversation that race is the risk, is not a risk factor, that it's racism, to being able to have a conversation and to think about the ways and act on ways to address racism as this fundamental cause of perinatal health disparities, as well as disparities in other arenas of health. But it is really through these publications that really has led to me wanting to look at, or needing to look at, that interaction between racial segregation and discrimination among Black women, in trying to understand how systemic racism becomes embedded to impact the health of Black women, Black mothers. And it's really this last paper in which that looked at racism in the form of racial microaggressions and the risk of preterm birth among Black women that made me really think about, outside of my own and other people I know, lived experiences, that racism is not experienced uniformly, that the tax associated with being Black in America is, it may differ by a number of things. And so this paper, in looking at racism in the form of microaggressions and the risk of preterm birth, we saw this nonlinear association in which Black women who reported experiencing, let's say, a moderate amount of racial microaggressions, so not none and not at the highest, like, let's say, quartile, they had the greatest risk of having a preterm birth. So in thinking about doing some further exploration and thinking about Black Americans not being a monolith, and thinking about what are the things that influence racial classification and experiences of racism. I ran into this model by Aaron Sellis. I think that speaks to the heterogeneity that is within the Black population here in the United States that is often overlooked. And so one of the areas that I've chosen to focus on is how ethnic appearance influences our lived experiences. And so skin tone, our most visible aspect of or part of our ethnic appearance in the context of racism becomes a social construct. And this social construct is used to assign privilege and opportunity based on the hue of one's skin. And it privileges those with lighter complexions that and more European features that approximate whiteness, our closeness to whiteness. And so in exploring skin tone as in reviewing the literature, looking at skin tone in the context of racism and health disparities or health outcomes. This slide represents some of the literature or some of the outcomes in which skin tone has been found to be associated with. And where you see a star, that represents where there are gender differences. And I want to just really point out that it's not just health outcomes, so those biomedical outcomes that maybe one would try to associate our skin tone or associate these skin tone differences with biology or differences in DNA. We see these differences, these skin tone differences or skin tone disparities across educational outcomes, employment outcome, economic outcomes, and some of the literature has also noted it with respect to experiences or reports of discrimination. So what I wanted to do in trying to advance the body of knowledge, since no one had really looked at, if there's these gender differences that are going on, what more gendered could there be than the experience of mothering or pregnancy and giving birth. And so I decided to look at the relationship between racial microaggressions and delayed prenatal care, being delayed prenatal care as a form of access or a measure of access representing a consequence of structural racism. And so what I was interested in seeing was whether or not everyday racial microaggressions experienced in and outside of the healthcare system was associated with use with prenatal care, and then whether or not this association was uniform across Black women, or whether or not it varied by maternal skin tone. And so what we saw was that women's experiences of racial microaggressions was associated with their receipt of any prenatal care, and it also varied by trimester, and that there was this, modification by maternal skin tone. Now, one of the things that struck me here was that the relationship between, or the way that skin tone modified the relationship between racial microaggressions and receipt of prenatal care wasn't linear, in part because of the definition of, of colorism or skin tone bias, which is that the social hierarchy benefits or privileges those whose skin tone approximates whiteness. And so thinking about the context in which the study was conducted, which was metropolitan Detroit, Michigan, and the fact that Detroit proper itself is about 85% Black, that made me think whether or not the reason why both light and dark complexioned Black women, so women at the ends of the color continuum who experienced racial microaggressions, were the least likely to have prenatal care, and that women in the middle of the color continuum there was an association between racial microaggressions and in everyday life, and its impediment in acting as this impediment to accessing prenatal care. And so that made me really want to look at whether or not the racial composition of a city and residential segregation or racial segregation, so where one lives, plays, prays, works, interacts with skin tone to influence one's experiences of racial discrimination. And, in terms of the literature on perceived racial discrimination and skin tone, there's only a few studies that have examined this link between the two. And that literature is really mixed. So, you have studies by Krieger, Borrell, and Verna Keith, one of my collaborators, and others who've found null reports, but then you have more recently Ellis Monk at Harvard, who has found that Black Americans with darker skin tone relative to those with lighter skin tone are more likely to report racially discriminatory experiences. And so what I'm going to present to you all is the first half of this, or present data representing the first half of this framework, this adapted framework by David Williams for the study of racism and health, in which I'm going to explore a multidimensional measure of racial discrimination and skin tone in relationship to experiences of discrimination. And to do this, I'm gonna be presenting data from the BIB study, so the biosocial impact on Black births study, which was a prospective cohort comprised of Black or African-American women age 18 to 45 years old, and they were recruited from prenatal care clinics in 2 Midwest metropolitan areas, and were enrolled in the study prior to their 30th week gestation. And while there is actually more than 205 pregnant women that are in the BIB study, there's a total of about 600. That data is in the process of being cleaned. And so I am presenting data results from the first 200, roughly 200 participants, individuals who are enrolled in the study. So these are just some of the different demographics for individuals enrolled in BIB, stratified by skin tone. About 22% of women reported having dark brown complexion. Just under 30% reported having a light brown complexion, and the majority report, or almost half of women reported having a medium brown skin tone. And this distribution very much looks like the distribution in the LIFE study for my previous publications, as well as in the CARDIA study, which is a longitudinal cardiovascular study that has occurred or has follow-up over the last 30 years. And they actually have a reflectometry-based measure of skin tone. When you look at the skin color reflectance score and break it into tertiles, it breaks down very much like this among the participants. So maternal skin tone, as I was mentioning, was in this study was self-report. It was a 7-point Likert scale, and we recoded it to increase interpretability and comparison with those previously published studies looking at skin tone and discrimination. So our measure of racial segregation was this multidimensional measure that was from the National Survey of American Life, that was PI'd by the late James Jackson. And I just mentioned his name because I would say that most of what we know about Black Americans and the health of Black Americans really stems from Nisal and his previous study. So this measure looks at or asks, when you think about the places where you've lived, gone to school, worshiped, or worked, were they mostly Black or were mostly Black or mostly white individuals there? And so this measure in Nisal actually has more items than this, but as you all know, if you have developed a survey and you're not the PI of it, you may only have so much room to insert the items that you want. So I did narrow it down to these 5 items. So high school, childhood, neighborhood, present neighborhood, place of worship, and place of employment. And what's really interesting is, I think, and it may not come to surprise for anyone, but the majority of the women in the BIB study lived in all Black to majority Black neighborhoods, or spaces, I should say. So to reduce the dimensionality of those 5 measures, used exploratory factor analysis and wound up retaining 2 factors. The first factor represents where women live, learn, play, worship. And the second factor really represents their place of employment. So that racial composition and where the first factor is racial composition in the spaces that they grew up in, that they currently live in, that they learned in, and that they worship in. And that second factor is the racial composition in the work environment, in their work environment. So this is just the distribution of the first measure, where women live, learn, play, and pray. The factor score was standardized so that for interpretability, so a score of 0 represents the spaces that they occupy. The racial composition was all Black. 100 represents racial composition that was almost all white. So this is the distribution of expectant Black mothers stratified by skin tone and the racial composition measure of where they live, learn, and pray. So what this graph shows you is that Black women with dark and medium complexion, they're more likely to live in racially homogenous or to be in racially homogenous environments or spaces, where lighter complexion Black women, they are more likely to be in racially isolated settings. So the question is, does maternal skin tone predict Black expectant mothers' reports of racially discriminatory experiences? And then the follow-up question was, does the racial composition where Black women live, learn, pray moderate the relationship between their skin tone and experiences of discrimination? And so we use for experiences of discrimination, we use Krieger's the measure developed by Krieger, and we asked women about lifetime discrimination attributed to race, ethnicity, or color. And there were 9 items representing settings, interactions with police, school, the public, service, hiring, getting housing, medical care. We looked at both the number of situations in which women reported experiencing discrimination, but also the frequency. But for today, I'm just going to focus in on the number of situations. So this is the this looks at women's reports of discrimination stratified by skin tone, and we see that so among those women who reported no that they'd never experienced discrimination in any of the 9 situations, they were more likely to be medium complexion or have light complexion. And dark complexion Black women were more likely to report experiencing any number of discrimination. So this slide is a little out of place. Oh, no, it's sorry. So just in, looking at the relationship between skin tone and our racial composition measure independently to women's experiences of racial discrimination. You can see here that, while the trend reflects that dark brown Black women are more likely to, or they report greater experiences of greater numbers of situations in which they've experienced discrimination. It's not, the confidence intervals overlap with one. But then for the racial, our racial segregation measure, we see that women who live, Black women who live in more segregated areas, they are less likely to report, or they report fewer numbers of situations of experiences of discrimination. And so when we look at the interaction between maternal skin tone and racial segregation, we see that for light complexioned women, when they are in should pause and say that for light complexioned Black women, they report a greater number of situations when they are in more racially homogeneous settings, and the number of items that they report decreases as they move to more racially isolated settings, so more white settings. But that trend is not true for women who reported having medium brown to dark brown skin tone. Being in racially homogeneous settings is actually protective against experiencing racial discrimination. And it's when they start moving into more racially integrated and racially homogeneous, not homogeneous, isolating, so those white spaces, that they experience more and more different types of they experience discrimination in more settings or more situations. So just thoughts on this is that there's considerable heterogeneity in lived experiences of Black expectant mothers, that the racism tax is not distributed uniformly, and it varies by skin tone and racial composition of the spaces that Black women grow up in, learn in, live in, currently pray in, and work in. And that when we think about the racial composition of the settings that we occupy, it can amplify or buffer potential experiences of discrimination. And so, and this has implications on perinatal outcomes, given past research by myself and others showing that racism is a fundamental factor of the perinatal disparities that exist in the US. And so just really thinking about this, going back to this relationship in the literature, this the mixed findings in the literature regarding skin tone and perceived racial discrimination, I think it's probably due to a number of things, especially in the way that racism has been conceptualized and operationalized in research. First of all, that there's numerous measures of perceived discrimination. And these global measures each capture something different. So for example, you know, I find that racial microaggressions, measure of racial microaggressions is actually more sensitive to skin tone than a measure of everyday discrimination. It also matters about the domains of discrimination that are investigated. So, for example, I looked at you know, those 9 situations. Some of those situations are more sensitive or influenced by skin tone than others. And that, I think, has to do with sort of more interpersonal interactions that happen. So in public, getting service, interactions with the police, relative to in today's contemporary racism, getting a loan from a bank or housing. And then I also think that there's a lot of the literature assumes that there's always going to be this linear relationship between skin tone and perceived racial discrimination. And what I showed you is that it is not always linear, that this relationship, that racism and skin tone bias are functions of the environment and the racial composition of that environment. And so it is, you know, just sort of bottom line, it's really important for us more to think about the context in which we are looking at these associations. So just sort of to kind of close or wind down here, as just thinking about, you know, I've spoken a little bit about the research that I'm doing in present, but what about the research that is going to occur in the future? And I only really spoke about one aspect of my research here, but these blocks sort of represent the domains in which I have either had funding or currently have funding or have projects in development in which we are awaiting funding. And so I'm really excited that I'm going to be part of a Center for Pregnancy and Disability and leading the efforts around trying to fill that knowledge gap around the intersection of pregnancy, disability, race, and ethnicity. And so I just wanted to really close with one of my heroes who I sorely miss because he was, he led with humility in all of the work that he did. And so for all of you that are interested in doing health equity work, whether it is practice, research, or praxis, whatever good work you do, whatever powerful, profound work, do it because it's necessary. Do it to make change for the better. Do it because you know you must, but don't do it for credit. And I think that's the thing that we, you know, as we step into spaces, step into the space to understand how racism impacts those who it marginalizes, as well as society as a whole. It's really important for us as researchers, leaders, teachers, you name it, to do this work with humility and not to do it for credit. So questions? Let's see. Okay, let's see. First question, can I comment on how your research may relate to the concept of power dynamics with respect to race and gender? So I think my research very much relates to concept of power dynamics around race and gender. From when we look at systems of patriarchy in conjunction with racism, we see that there is this intersection that occurs in which these systems of oppression genderize the Black body, the Black female body, they racialize the Black female body, and they even colorize the Black female body. And what this does is it, I think, creates this unique social location in which there are processes of exclusion and cumulative stress that are unique to Black birthing people. And if you were to add in the intersection of gender identity, we'd probably, see even in possibly even wider disparities.
You can feel free to put questions in the chat, or I think Gerald has given all of you the power to unmute should you want to. And you can ask questions directly that way.
Hi, this is Jeanette. But by the time I type it, it will take forever. So if you don't mind, I'll just ask.
No, it's fine.
Thanks so much for a great talk. I was wondering, I also happen to be perinatal epi, and so your work is just so interesting to me. But there's really a need for us to just better measure structural racism. And I was wondering if you would just comment on how some of these methods that you're developing could be used more broadly in epi, because I think there's a real need. And so I think we all tend to focus on our own little area, but like this seems to me like could have much broader impact. So I was wondering if you could comment on that a bit, if you don't mind.
Yeah, so that's a really good question. So I think one of the areas that we need to focus on is our terminology, right? So when we say systemic racism, when we say, so when we say systemic, structural, institutional, do we have a clear understanding which each of those means? Are they synonymous? And I think letting research inform our understanding of how structural, institutional, and systemic overlap, but are similar. And in what spaces are maybe they're synonymous, right? I think that's really, really important. The other piece of this is, at least in my work, right? Skin tone, sometimes when I'm asking a question about the social significance of skin tone, I'm specifically looking at skin tone bias with respect to perinatal outcomes. But skin tone bias operates on in sort of two different ways, as a function of in-group buy-in of that social hierarchy, but also out-group. And it's that out-group skin tone bias that really amplifies or can amplify that relationship to what we typically think about when we're talking about racism. Whereas that in-group skin tone bias is usually what gives us that sort of U shape often. And this is important, and I'm getting to your answer. This is important because it means that skin tone, it means that skin tone is structural in nature, right? It takes on a social and structural meaning that is exuded in our outcomes, in health outcomes, right? And so if you don't understand that, then when you're talking about structural racism and you're looking at structural racism, or you're trying to measure it through, whether it is looking at voting access, or police violence, or suspension rates at school, you will not truly understand how that racism tax is being applied. And so that's how I think, or where I think some of my work has impact on these measures of structural racism. So it's sort of really thinking about getting at more of the totality of things.
Thank you.
Oh, okay, so let's see. I mentioned various additional outcomes, general health, housing, that may be related to or be impacted by skin tone and perceived racial discrimination. Let's see, expand on these outcomes. Which ones are more important to better understand? That's a really good question. I think some people would be mad by me saying the interpersonal ones, really understanding how skin tone impacts perceptions of self, as well as collective and resilience resources. So things like linked fate and racial identity, because those are constructs that can be integrated into youth development programs. And I guess I maybe say that because as a social epidemiologist, I believe in doing work that tears down the structure of racism, but I also know, I'm a realist, and I know that it is, this system has been around and ever evolving for the past 400 plus years. And so even if interventions at the interpersonal level is like throwing a stone into a pond, I think it is important for us as equity scholars, researchers, and interventionists to make waves in that water. So that's where would be my first inkling. I mean, I think to truly understand how color or skin tone influences structural racism, so thinking about that policy level, I do think there needs to be a little bit more work understanding or just showing how skin tone as a social construct modifies structural racism. Otherwise, you'll wind up building policies or implementing policies that may do more harm than good, or just widen disparities. And you can look at some of the more recent Supreme Court cases in which individuals who bring, it is easier to win a discrimination lawsuit if you are claiming racial discrimination, but when you then when you bring a discrimination lawsuit claiming color discrimination. And part of that problem is because color and race are often interpreted as being synonymous, but they're not. And so, I think just like we're having to show that these colorblind policies in today's contemporary, as today's contemporary form of racism, I think we're gonna have to show that color and race are not, they're not synonymous, that they're actually interacting constructs that, yes, stem from the same father. So they're children of racism.
We have 1 more minute. I don't know if anyone has any other questions. I see. Thank you for a thoughtful discussion. It was very interesting. And I think many of us learned a lot about a topic that perhaps we haven't heard quite a bit about yet. So we're glad to have that and to have you talk with us today, Jamie. We really, really appreciate it. Is there any other closing statements that you wanted to make before? Because we're at time.
No, I mean, I really enjoyed sharing this work with you all. It's new work, and it's work that's, evolving and generating additional preliminary work. I have a preliminary study that is, it's a mixed methods, really trying to basically better understand experiences of in-group and out-group skin tone bias or differential treatment. So if anybody would like to learn more about that, or if you are someone who believes in mixed methods and qualitative use of qualitative data to inform quantitative data, feel free to reach out as we are just getting started with doing the coding. So.
Well, thank you very much for joining us today. There's a question about your contact information, and I'm certain we can share that around if you're okay with that. And I know you have a really great website too that folks might want to look at that talks about your work, in particular, talks a lot about this topic and delves into it a little bit more. Oh, thank you for putting your UMN email there. So thanks for joining us today, Dr. Slaughter-Acey, and for giving us a great talk, and everybody else for